They'll say when with a signal. So, clinicians often have questions about how to treat co-occurring disorders, psychiatric and substance use disorders. One of the models, especially psychiatrists, that exists that doesn't work very well is, so if they have a drug use disorder and ADHD or depression or a common co-occurring disorder, they're hesitant to treat the depression or the ADHD, for example, without the adolescent or young adult being abstinent. So oftentimes the person is referred to drug treatment, and really with the expectation that they get a sustained abstinence under their belt, do well in drug treatment before they're treated for their depression and ADHD. We know that doesn't work. They have poor treatment outcomes, and it makes sense. It's hard to be successful in drug treatment under the best circumstances. If you have an untreated Axis 1 mental illness, it's going to be really tough. So that begs the question, though, well then, does integrating treatment for mental health substance give you better outcomes? And there has been, to date, pretty positive research on that. But for the last 20 years, I've been doing research, and other colleagues, on integrating the treatment with psychosocial treatment. Predominantly, we use cognitive behavioral therapy for drug use disorders. And in the context of that drug treatment, we also treat the psychiatric co-occurring disorders, such as depression and attention deficit hyperactivity disorder, conduct disorder, ADHD. So our studies have shown that integrated treatment is very promising. That is, if you combine the two and concurrently treat, sometimes using pharmacotherapy. Some pharmacotherapies are proving safe and effective in kids who are still not clean, as long as it's in the context and they're compliant with drug treatment. And I think that one of the things we've also learned, since there has been so little literature and so few studies done in these kids, I draw from other studies, such as longitudinal studies showing resilience factors and education literature. One of the things that's emerging is that's important for mental health clinicians, primary care physicians, parents, as well as treatment providers who are treating drug abuse, is to really do everything we can to involve the kids more frequently in pro-social, non-drug related activities that are really incompatible with drug use but are still as alternative reinforcers. That has been shown to be protective against initiating drug use in kids who have risk factors. It's been shown to help reduce drug use or to augment treatment outcomes, and it's also been shown in adult studies and adolescent studies that it helps ensure or prevent relapse or sustain the gains of treatment. So that's one thing we all can do.